Now, there's absolutely no place in the Gaza Strip that is safe. There is not one school nor one hospital where people can in fact go to in fact save their lives. Now, this is what is happening at this moment. There's literally not a single place in the part of the Gaza Strip that is safe at all. Even the safest of places in a time of war, which are protected under international law, like for instance schools, where people have taken refuge, like for instance hospitals where people have taken refuge, are also coming under attack. Now, the Israeli army claims that it has brought the war to the gates of the Al-Shifa hospital, the biggest hospital in the Gaza Strip. Remember, an estimated 60,000 people, 60,000 Palestinians had taken refuge within the premises of the Al-Shifa hospital because their homes had been bombed and they literally had been driven out of their homes, and they had come to the Al-Shifa hospital seeking refuge. And now the Al-Shifa hospital too is bearing the brunt of this war. Thousands of injured and displaced Palestinians are trapped inside the walls of the hospital, as this hospital, according to information that has now come in, has now been completely surrounded by the Israeli military, and there is a ferocious assault that has been unleashed on it. The constant airstrikes are a heavy blow to the healthcare system, and in fact the doctors in the Al-Shifa hospital say that their systems have literally collapsed because the hospital has run out of fuel. The operations in the Al-Shifa hospital had been suspended due to a lack of resources and power cuts. The doctors in the neonatal ward have been forced to carry out artificial respiration by hand on about 36 babies. Doctors Without Borders have said that it has lost all contact with the staff inside Gaza's biggest healthcare facility, the Al-Shifa hospital. The situation has literally gone out of hand, and now, according to information that has come in, at least about 3 children have been killed, and 39 young children who were in incubators passed away because the generators had to be turned off because there was no fuel, and therefore the oxygen supplies in these incubators went off. The hospital authorities have narrated the conditions of what is happening. They've issued an SOS call urging the world to come to their rescue.
الجثث الآن تملأ ساحة المستشفى، خصوصا بعد مجزرة مدرسة البراق التي أسفرت عن 50 شهيد وملقون في الساحة الأمامية للمستشفى، بالإضافة إلى وجود عشرات الجثث الموجودة مسبقا في مشرحة مجمع الشفاء الطبي. لا يوجد كهرباء لحفظها ولا يوجد إمكانية لدفنها. النفايات الطبية لا يمكن إخراجها من مباني المستشفى، مما يهدد بانتشار العدوى ووجود كارثة في المكان. خيام النازحين اشتعلت فيها النيران نتيجة القصف المتواصل لساحات ومباني المستشفى.
Here in Gaza we facing bad war crimes. Hospitals now in the north facing direct bombing from the Israeli warplanes. There is no spaces for the patients, there is no blood for them, and there is a lot of killed body around the hospital. Inside the hospital the killed body cannot be contained. This is a call for a human community. This should stop now. We cannot continue with such war crimes. It is unlogic. There is no excuse to have direct attack toward the hospital.
According to reports, the Hamas fighters, this is what the Israelis are of course claiming. They say that Hamas is hiding inside the hospitals and therefore they are going after the healthcare infrastructure in the Gaza Strip. The Israelis claim that there is a command center underneath the Al-Shifa hospital. The Israeli forces are making their move and they are trying to enter into the premises. The IDF has ordered the hospital authorities to start evacuating the place completely. Now remember, there are an estimated 60,000 people that we are talking about who have sought a refuge inside the Al-Shifa hospital. They had come there in the hope that they'd find some bit of respite from the bombing, and now they're being told to evacuate from the one place that they thought they would be safe. But what is clear is that there literally is no place that is safe, not even hospitals, not schools. There's not a single place of refuge which is not getting bombed as we speak. All right, now to tell us more as to what is happening at this moment in the Gaza Strip, and especially in terms of the health infrastructure there, we're being joined by Mr. Benoit Carpentier. He's joining us live from Geneva. Mr. Carpentier is in fact the spokesperson for the International Federation of the Red Cross and the Red Crescent Societies. Now, Mr. Carpentier, there are some very distressing images and reports that are emerging from the Al-Shifa hospital, which is the biggest healthcare facility in the Gaza Strip. Tell us, are you even able to contact with members of the Al-Shifa hospital there?
Afternoon. Yes, the images are more than distressing, and we've been alerting the world for weeks now that this was coming. The Al-Shifa hospital is, as you said, the biggest hospital. We are with the Palestinian Red Crescent operating in the Al-Quds hospital, and they are facing more or less the same issues, which is lack of electricity, lack of fuel, also lack of electricity, intense fighting around the hospital, and not being able to operate at all. Palestinian Red Crescent runs the hospital, but they also run the ambulance services. And because of the fighting, because of the state of the roads, and because of the lack of fuel to be able to operate the ambulances that have not been damaged during the fighting, they're actually unable to operate at the moment. We've lost contact with them for several hours now. So because of the fighting and the damage on the lines, it's very, very complicated to get a good picture of what's going on, but we know it's terrible.
And also, Mr. Carpentier, Israel continues to claim, it's been doing this for the last several weeks now. It says that Hamas has got its command center underneath the Al-Shifa hospital. Now, you are a spokesperson of the Red Cross and the Red Crescent Societies there which operate. Now, the question that I want to ask you is, is there any evidence whatsoever to state that Hamas has got its command center under the Al-Shifa hospital?
This is not, our position or mandate or role to do that. What we have to look at is the numbers that you gave earlier, the 60,000 civilians, the staff, the health workers that are in the hospital and that need to be protected. There's absolutely no negotiation on that. So that's what matters for us, and that's what needs to be respected.
But also there are reports that the Al-Shifa hospital is now completely run out of fuel, and therefore the incubators in which about 38 young babies were in, they have died, is the report that has come in. Can that be confirmed?
We're not operating directly in Al-Shifa, but in Al-Quds hospital, where the Palestinian Red Crescent operates, we have exactly the same situation. We have babies in incubators. We have 3 infants that are on life-saving incubators. We have 8 patients that are on ventilators, besides those who are also in the ICU. And they are going to run out of fuel and electricity. Those people, those children, those babies, the moment the electricity is pulled off, will die.
And also, hospitals are protected under international law. And the fact that the Israeli army is reported to be carrying out operations so close to the hospitals, and in some cases, some of these hospitals have even come under attack. How does the Red Cross and the Red Crescent intend to even address this issue?
We've been addressing it since the beginning of the conflict, and we will always do it. And as I said earlier, the hospitals, the civilians, the health workers are protected and must be protected at all times. So we can only repeat our calls and address all parties to make sure that happens.
And my last quick question to you is, now Israel has been talking about humanitarian pauses for a period of 4 hours. So in these humanitarian pauses, has it at all been possible that some kind of aid, some kind of medical supplies have been taken to the hospitals in the northern part of Gaza?
That's the issue. That you have a conflict area. You have roads, infrastructures that have been damaged by the bombing. You have an immense amount of needs and people. So 4 hours is very small compared to what needs to be done. We need uninjured, safe access with a constant flow of aid entering Gaza. There's been trucks entering Gaza over the last 2 or 3 weeks now, but that's obviously not enough at all, and that's not reaching the north at all for the moment.
Absolutely, indeed. Thank you very much indeed, Mr. Carpentier, for joining us and getting us that perspective there.